Defer my questions for a while and ask Mr. Thompson to begin.
Thank you, Mr. Chairman. Thank you for holding this hearing. Thank you to all the witnesses for being here. It's a very important issue for all of us. And every one of us on this dais have heard from our constituents about the ridiculous cost of prescription drugs, and many of those are Medicare folks. So to look at the Part D proposal is just, I think, a great place to start. And in the Congress, in this session, there are a number of proposals dealing with the issue of the high prices of pharmaceuticals, licensing to require negotiation, arbitration systems, incentives to encourage participation in arbitration, tax penalties for drug makers who don't negotiate, and relying on international reference prices to figure this out. So we all agree that we need to do something, but we need to make sure that the avenue that we pursue is the most transparent way, and it's done without cutting access to the needed drugs that our constituents rely on. And we don't want to stifle innovation. I think we probably all agree on that. And then in a district such as mine, and there's other folks on the dais from rural areas, but rural areas suffer, as do underserved areas, for a whole additional set of issues. And I know that the PBMs imposing direct and indirect remuneration fees has really hurt my rural folks, and I suspect it's having the same impact in other underserved areas. So I'll start, Ms. Feldman, with you. What should we do about improving transparency in this particular area?
So you mentioned the rural areas and the independent pharmacists. In many cases, those independent pharmacists are the best friend that a patient can have in this process, and they are being mercilessly squeezed by the PBMs. The clawback system that you alluded to, the PBMs pull back payments after the pharmacist has prescribed the drug, and often the pharmacist can't make any money. If you're a big PBM and you own a big pharmacy, you're moving it from one pocket to the other. But if you're an independent pharmacist, it can drive you out of business. It's a terrible problem, particularly in rural America. I do think that the focus has to be in a couple of areas. One, transparency. We need to shine the light on the deals that are being made so that the market can work its magic. And second, we need to rein in all of the protections that companies are piling on one after another.
And Dr. Sarpatwari, can you tell me what impact this rebate bundling and pay for delay is having, and what sort of redress should we figure out for that?
Sure thing, my pleasure. I'll start with the pay for delay. This is a particular issue in terms of new, very innovative biologics that are coming on the market. And there you've got a situation in which you have, as of February, I think it was something like 17 new biologics approved, but only 7 biosimilars approved, but only 7 on the market. The reason is that there were patent settlements in these cases. And the question is, these patent settlements benefit the parties, but they don't benefit the public. And what is essentially going on is we have, as a republic, said that we want to foster innovation, and you should have a certain period of exclusivity as a reward for your innovation, but these pay-for-delay settlements are extending that artificially. And there is legislation in Congress that would force those disclosure of those agreements to actually be public. And in those cases, that would enable better assessment of whether or not they are actually anti-competitive. And then in the case of rebates, I think we need to be careful in general about saying rebates are necessarily a bad thing. We have PBMs that have questionable business practices, but we also know that these PBMs have great purchasing power and are able to extract significant savings off of the price of drugs. What we need to do now is regulate their practices to ensure that those rebates actually are passed on to the payer and to the patient. So removing them from the system, I think, without some solution is not going to be helpful. They can actually play quite a good role in the system.
Thank you.
Thank you very much.